Hi, my name is Dr. Jerald Goldstein. I am the medical director and founder of Fertility Specialists of Texas. We were founded over 20 years ago and have helped thousands of women and men build families. I want to talk briefly about the most recent decision of Roe v. Wade and provide a little background of how we got to where we are right now and what are the concerns of how this decision could affect fertility care. The short answer is that nothing will change in terms of what we do here at Fertility Specialists of Texas. We are creating life. We are building life, and while there's a lot of discussions about how this may affect fertility, in reality, I don't believe it will have any effect. To understand how IVF and creating embryos is even being discussed, given the most recent Supreme Court decision, I'd like to review a little bit about fertility and fertility treatments. During a normal menstrual cycle, the brain secretes hormones that create one egg or follicle that eventually is ovulated. The eggs are fertilized in the fallopian tube and go into the uterus and implants, resulting in a pregnancy. It really, however, is an inefficient process because these fertilized eggs or embryos often don't implant, or sometimes they implant and result in a miscarriage. In IVF, we use the same hormones in the form of injections to create as many eggs as we can. Through a series of shots or injections for about 2 weeks, eventually we were able to take them out of the body and fertilize them in the laboratory. An embryologist will then watch these fertilized eggs or embryos grow over 5 to 7 days and then biopsy the embryo prior to freezing the embryo. It is important to realize that while you may create 10 or 12 eggs during the IVF process, you may only end up with 2 or 3 embryos on day 5 or 6. In IVF, the number of embryos you make really depends on your age. We know that not every egg fertilizes and not every fertilized egg makes an embryo that is genetically normal. Pre-implantation genetic testing has allowed us to test and see which embryos are genetically normal. Why test embryos? Well, we were able to determine which embryos are not chromosomally normal and therefore prevent, for example, miscarriages, which is a very painful process to go through. Why is this a concern for us, and how does it affect IVF clinics? In the decision of Dobbs versus Jackson's Women's Healthcare, the Supreme Court held that the right to termination of a pregnancy was not a constitutionally protected right, as previously decided by Roe v. Wade. So in the past, when states would pass different laws trying to limit access to abortions, these laws were not upheld because of the 1973 Roe v. Wade decision. What the court is saying now is that the decision regarding whether you should be allowed to have a termination should be made at the state level and not at the federal level. We are a fertility clinic. We do the opposite of terminating a life. We create life, which is why what we do is truly an amazing process. The most important thing to understand is that words have meaning and language matters. So when one specifies in a law of when life begins, then this gets very close to potentially interfering with the work that we do every day. In IVF, fertilization is not occurring inside of a woman's uterus, but in a laboratory, in a petri dish. The embryo developing inside the uterus has the ability to attach to the maternal circulation and eventually have a beating heart. An embryo in a petri dish is a ball of cells called a blastocyst that does not have this ability. This means we have to be very careful about giving a ball of cells in a petri dish as the same rights as embryos that have developed inside of a uterus. Unfortunately, I believe the laws that have been written are vague enough to make one question about if they apply to embryos that are created in a laboratory or petri dish. With that being said, even if you look at states that have passed very strict laws, such as Oklahoma, the state representative who wrote the law stated very clearly that this bill defines abortion as a termination of a pregnancy in a woman and not in a petri dish. In Alabama, a state that quickly adopted an abortion law through a trigger law carved out specifically that applies specifically to a fertilized egg once in the uterus, thus exempting those made or frozen in an IVF clinic. So what should you know? The current law is in regard to termination of pregnancies in a uterus. The laws to date have been directed to the termination of pregnancy, not the creation of a pregnancy. As a fertility clinic, rest assured that we are going to protect your embryos, and we are going to work together with the American Society of Reproductive Medicine to make sure that when laws are passed, they're written in a way that do not limit our ability to help build families. We as fertility doctors and you as patients need to reach out to your legislatures to support fertility care and understand how new laws that are written may interfere with our ability to create families. We need to let them know that language is very important, in particular to how you are defining when life begins. I don't believe that our lawmakers want to create laws that make it difficult for people to build families, but the way that laws are written could have the unintended consequence of affecting what we do every day. At Fertility Specialists of Texas, we are proud that we are able to make a difference in the lives of so many people, because we know, and you know, that after you have kids, your life is very different, and we are as committed to making that happen as ever. Thank you.